The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.
Hello and welcome to the ASCO Guidelines Podcast Series, brought to you by the ASCO Podcast Network, a collection of 9 programs covering a range of educational and scientific content and offering enriching insight into the world of cancer care. You can find all the shows, including this one, at asco.org/podcasts. My name is Brittany Harvey, and today we're continuing our series on the management of immune-related adverse events. I am joined by Dr. Yinghong Wang from the University of Texas MD Anderson Cancer Center in Houston, Texas, author on management of immune-related adverse events in patients treated with immune checkpoint inhibitor therapy, ASCO Guideline Update, and management of immune-related adverse events in patients treated with chimeric antigen receptor T-cell therapy, ASCO Guideline. And today we're focusing on gastrointestinal toxicities in patients treated with immune checkpoint inhibitor therapy. Thank you for being here, Dr. Wang.
Thank you, Brittany. It's my great pleasure to be invited to participate in this education event. I'm happy to share my experience and the knowledge that I learned over all the research studies in this field and share with the readers or the community providers on this specific topic.
Great, thank you. Then first, before we get into the content, I'd like to note that ASCO takes great care in the development of its guidelines and ensuring that the ASCO conflict of interest policy is followed for each guideline. The full conflict of interest information for this guideline panel is available online with the publication of the guidelines in the Journal of Clinical Oncology. Dr. Wang, do you have any relevant disclosures that are directly related to these guidelines?
I do have consulting services to pharmaceuticals, but they're not related to the current guidelines that are published from the ASCO. They're TLARTS Pharma and Azurax Pharma.
Okay, thank you. Then let's talk about these gastrointestinal toxicities. So first, what are the immune-related gastrointestinal toxicities addressed in this guideline?
So this particular guidelines have provided very detailed description on the incidence and clinical presentations and also recommendations on the evaluation and treatment for the upper and the lower gastrointestinal adverse events and liver and even other organ toxicity, including the exocrine pancreas toxicity that are being kind of categorized as GI field related to checkpoint inhibitor treatments.
Okay. And then what are the key recommendations for the identification, evaluation, and management of colitis?
So colitis is definitely kind of one of the most common organ to be involved in this category of toxicity-related checkpoint inhibitors. And that's why kind of a lot more studies has been studied because of the patient volume kind of allow enough power to run a lot of analysis. I think the summary that I would say the recommendations from the current ASCO guidelines include the early recognition and evaluation with close monitoring for people who had suspicious symptoms for gastrointestinal adverse events and early stool inflammatory marker evaluation, even in patients who had a grade 1 symptoms, and very important to rule out alternative causes of the symptom presented like infections or cancer metastases or some other medication-related side effects other than checkpoint inhibitors. And the other important components of evaluation is endoscopy and pathological evaluation for patients who had a positive stool inflammatory markers or if the patient has a presentation of colitis symptoms like bleeding. And also the presence of ulcers on the endoscopy usually has been found to predict a steroid refractory disease course. Therefore, the early initiation of more potent treatment like biologic agents such as infliximab or vedolizumab is very critical. The other alternative medical treatment like ustekinumab or tofacitinib or even fecal transplantation for refractory cases should also be considered in the small portion of patients. The disease monitoring while on the medical treatment is critical via the repeat endoscopy or following the fecal calprotectin level to guide the duration of treatment and the time to resume immune checkpoint inhibitor treatments if indicated. The re-challenge of this checkpoint inhibitors is possible among patients with GI toxicities, and the risk of GI toxicities is completely manageable. That's kind of the brief summary of the GI recommendations.
Yeah, thank you for that summary. And then just in addition to those key recommendations, is there anything additional about the identification, evaluation, and management of hepatitis?
Yeah, the hepatitis, the incidence is not as common as colitis, but can be severe in extreme cases. So it requires the equal attention to recognize and evaluate for liver toxicity after checkpoint inhibitors with close monitoring. We also need to rule out other alternative causes of the symptoms, including the infections, alcohols, iron overload, thromboembolic events, cancer metastases, etc. The imaging, on the other hand, is more critical for liver toxicity evaluation. This is a little bit different from using the endoscopy and biopsy for luminal GI tract toxicities. And the liver biopsy should also be considered in certain selected cases to rule out other differential diagnosis. And also the other alternative treatment other than corticosteroid, including azathioprine and mycophenolate methylphenidate, that are kind of mentioned in the small case series and also listed in the current ASCO guidelines.
Great. Thank you for that overview for both colitis and hepatitis. So then, in your view, how will these recommendations for the management of gastrointestinal toxicities impact both clinicians and patients?
Yeah, given the increasing volume of patients experiencing the GI adverse events related to the checkpoint inhibitor cancer therapies and their related morbidities, so both the clinicians and patients need to be familiar with the clinical presentations and the time frame of onset to ensure early recognition and early diagnosis. Especially serious complication and even mortality can occur due to the significant delay in appropriate treatment in extreme cases. So the updated guideline provided by ASCO and also other professional societies in the US or internationally can provide a great resources to the academic and community clinicians when they encounter these cases in their practice. So ultimately, the implementation of appropriate management and future prospective clinical trials in this field for these challenging conditions should improve the patient's outcome of toxicities and also cancer. And that's the goal of our clinicians and academia providers, to be able to serve the patient better in the future.
Definitely. Well, thank you for sharing this summary with us today, for all of your work on these guidelines, and for taking the time to speak with me today, Dr. Wang.
Thank you very much for this opportunity. Please let me know if you have any question.
And thank you to all of our listeners for tuning in to the ASCO Guidelines Podcast Series. Stay tuned for additional episodes on the management of immune-related adverse events. To read the full guideline, go to www.asco.org/supportive-care-guidelines. You can also find many of our guidelines and interactive resources in the free ASCO Guidelines app, available in iTunes or the Google Play Store. If you have enjoyed what you've heard today, please rate and review the podcast and be sure to subscribe so you never miss an episode.